Dr. Rich Castellano here, the Smile Doctor. Thank you for letting us share your video today. We're here with Lisa. And Lisa, we're going to be doing some Sculptra, some fine line filler, and we're going to be lifting and some eyelid treatment. Are you excited about this?
Yeah.
How long have you been waiting to have this done for?
Probably 20 years.
Wow. We feel very special to be a part of this with you, Lisa. Lisa's a giver. We love to give to the givers. It is her day today. So what was it? You've been thinking about this for 20 years. What was it that inspired you to say, I'm going to do it?
Timing is right, and I just moved here to the villages. It's quiet right now. COVID is taking over. Seems like a good time.
It's a good time to do it, and we are wearing our tappers. This is a 3M VersaFlow helmet that is a HEPA filter to filter the particles so we keep our patients safe, we keep our team safe. We've got Lainey, who's got everything set up perfectly, and we have Christine, who's our camera person. So I'm going to do my cleansing. Here's our photos, right? We always take our pictures, and you can see the hollows we're going to treat under the eyes. We're going to trim a little eyelid skin and around the mouth. So, Lisa, did you tell your family and friends what you were doing today?
I sure did.
What did they say when you told them?
They could understand why. They felt the same way about my neck and my eyes as I do.
Okay, all right. So we're going to get things started here now. Are they going to be upset if we make them look younger than they do?
I don't think so. I think they've all had something or other done.
Okay, so now it's your turn.
That's right.
Very good. So for my physicians and students that are watching, I like to use the HIBA cleanse, and Lainey has everything set up perfectly. Thank you, Lainey. So the HIBA cleanse is a skin cleanser. I'm going to be treating around the smile lines, the cheeks, a little bit in the brow, and in fact I just did some of my Sculptra about a week ago. I didn't have any bruising, and so there's no downtime with the fillers. Now we will be doing the lift as well, so obviously there's some recovery with that. I'm doing a little bit extra cleanse on the skin. I like to also follow up with an alcohol swab. Cleansing in through these areas. There's no restrictions after the filler. I like to recommend that 5-minute massage 5 times a day for 5 days. And I'll just probably need one if you could set those to the side for me, please. And I like to use a vibration distraction. You have you rest your head all the way back. The brain can only focus on so many things at one time, so she'll feel the buzz. Pinch on 3, 1, 2, 3, pinch. 1, 2, 3, pinch. It's very normal that we hollow out. 1, 2, 3, pinch. A little pinching through here. Around the eyes, so now we're filling that volume back in. Turn your head this way a little bit. And these little creases in the corner, pinch, is what bugs Lisa, so we're going to fill those areas. There are 2 general ways you inject with filler. You can go intradermal, that's in the skin. Think of it as if we're wearing a mask, right? You can inject right into the mask, or you can inject under the mask. So that's the intradermal versus the subcutaneous injection. And there's 2 different ways you're going to layer the filler. Pinch, 1, 2, 3, pinch. Sorry, pinching, that's a little tender. 1, 2, 3, pinch. Do you feel small, medium, big pinch? What do you feel there, Lisa?
Stick in my face.
A stick in your
A
face.
needle. It feels like a needle.
A big pinch, little pinch, medium, what do you think?
I guess above medium, but not quite.
Okay, so you feel buzz, we go slowly, 1, 2, 3, pinch. How about there, small, medium, big?
That was more of a medium.
Medium, okay. Pinch down here, 1, 2, 3, pinch. So we go slowly, but that's a little bit bigger pinch there. And we're not in a hurry. If Lisa needs more time, we take more time. How about now? Small, medium, big pinch, not too bad?
Big pinch.
That was a bigger pinch there, so we're going to go slowly. And 1, 2, 3, pinch. So we're going to be injecting the smile lines, the cheeks, the brow, and when you do the lift, into here, 1, 2, 3, pinch. You feel small, medium, big there.
Small.
Smaller pinch there. This is in preparation for the lift. 1, 2, 3, pinch. Small, medium, big pinch there.
Small.
So if we get away with the little pinches here and there, and then when it's time for the lift, you don't feel anything at all. So, are you feeling any pain right now?
No. I can feel a little numbing.
Numbing is good. That's what we're here for. So I'm going to start out with the Sculptra, and it is a safety cannula that we use. Do you feel a little pinch here or not too bad?
Not too bad at all.
How about here? Small, medium, big pinch, not too bad?
Not at all.
So once the numbing medicine's there, then it just makes everything else so much easier. So because the cannula is a blunt tip soft cannula, that's why we make the little insertion point in the skin. Very good. Okay, so are you feeling any discomfort at all, Lisa?
None at all.
Me neither. Just gonna do a tiny bit more mixing. I like sometimes it just settles a little more. This one looks pretty well mixed, but I like to do a little extra here. Now I'm gonna turn your head this way just a bit. Feel a little pressure, a little pinch. You feel big pinch, little pinch, not too bad?
Not too bad.
Turn it this way. Pressure pinch, pressure pinch. So as you can see, when you use a small amount over a large area, it looks very natural. You're not going to overdo it. Now, if you want to make your best choices in plastic surgery, you must know the ABCs of plastic surgery. When you know the ABCs of plastic surgery, you will definitely make better decisions. You turn your head this way. We share this with all of our patients. So, A stands for area. There are 4 areas that we address to improve the facial appearance. If we sag, we tighten, which is what we're going to be doing today. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift. When we smile, that always looks the best. So that's the A for areas. Now the B stands for boundaries. What are the boundaries of good cosmetic treatments? You turn your head this way. Number 1, safety always is first. Number 2, you must look natural, and you will. Number 3, we want to prevent future aging changes. And number 4, let's get as much improvement as possible. Now, we can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, that's better than going too far. So that's A for area, B for boundaries. C stands for combination treatment. If you want your best results, we combine treatments, which is what we're doing today. We combine tightening, and turn you this way, tightening, volume, and skin treatments for the best results. Now, if somebody wants their best results, you feel a little pressure pinch there, not too bad?
Not too bad.
If they want their best results, but they only want one treatment, then we usually talk about tightening. And if someone wants their best results with no downtime, then we talk about fillers. Fillers do a great job, but they don't give us a lift. Lifting, I get wonderful results, but I can do even better when I combine. So when you understand the ABCs of plastic surgery, you will make better decisions than other people do. So that is key. Let me turn you this way a little bit. People are getting into trouble today. We're going to keep you safe. We're going to help you raise your standards for cosmetic treatment. We're going to help you avoid bad plastic surgery. We're on a mission to stop bad plastic surgery. And we're here to help you raise your standards. Very good. So a little touch here, a little touch there. Thank you. Pressure pinch. Sculptra is a gradual filler. You need about 6 to 8 weeks to see a primary result, but even at 6 to 8 weeks, you'll see more improvement in 4 months and 6 months. So Sculptra is a gradual filler, delayed gratification, but certainly works very well. For improving facial volume. Last little bit here, then we're going to do some of the fine line fillers. Very good. A little bit more for the cheek. Some patients are happy with one session, some are not satisfied until they do a second session or a third session. But this way you know you're not going to go too far. We're located in Tampa and the Villages, Florida. We're going to do a little bit of that fine line filler as well. And we're going to be doing some of the tightening and numbing treatments. Tightening for the eyes and for the lift. So this is the fine line filler. And we talked with Lisa, she did not want to plump the lips, so we're not going to do any plumping. We're just going to be treating these little creases here. Perfect. In the corner of the mouth, we get that downturn, so we're going to fill a little bit in there. And this little crease that we get here in the smile line. We always have one side of our face that looks a little different than the other. We've all got asymmetry. And we even smile a little harder on one side than the other. That's very normal. And just because we don't see ourselves the same way that other people see us, you don't want to be too hard on yourself when you turn your head this way a little bit. Perfect. The corner of the mouth will fill a little bit in there. It's very important that you have an experienced injector. Keep you safe. Make sure you look natural. You don't want to go too far. In Lisa's words, these were driving her crazy, these little creases here. So we're going to do the lift and plump in these areas. But we're also plumping some of the little tiny creases here as well. Make a big smile for me, big smile. Patients ask me, are my dimples going to go away? The answer is no. Your dimples are not going to go away. Now relax as best you can. Very good. And you see how we build in that corner of the mouth, how those areas improve. Now I'm going to go, I like to look at their pictures for reference, because I'm watching where these little creases are in here. And I know I see this little one turn here for me. Very good. Yeah, that's right in there. We got that one. And then I want to focus on her left side. Right in through here. And then we massage to smooth things out. Okay. Very good.
Dr. Castellano?
Yes, go ahead.
Somebody's asking, is there a procedure available to help the neck skin area?
So that's what we're going to be doing next is the lift, where we tighten through this area So you can look up our book. We guarantee we can make you look younger. It's on Amazon. Hit the Wall Street Journal bestseller list. Did you have a chance to look at the book, Lisa?
I did.
Was that helpful?
I love reading the book. I love looking at the differences in before and after.
Good, good. If you read that book, patients, you're ahead of the game. And patients feel very prepared. So, right now we've done a little sculpture through the brow, the cheeks, around the mouth, and the fine creases. And let's take a look. So, can you see how those areas clump out around the mouth?
Absolutely.
Do you like what you see?
Yes, I do.
So we're going to look at your pictures. That's the
The wrinkles
after.
look like they're gone.
But here's the before, and so it looks very
Oh my
natural.
goodness.
And
Yes.
now we're going to focus on the neck down below. So we'll see you guys in the next video. This is the right way to do things. You want to raise your standards. And we're on a mission to stop bad plastic surgery. Happy New Year. I'm Dr. Rich. Thank you, Lisa. I give you a big hug. And more is coming. We're going to do the lift next. So we'll see you in the next video. Congratulations.